Hello and welcome to the Beef Edge, the Teagasc Beef podcast, for all your latest news, information and advice for Irish beef farmers. I'm Catherine Egan, and on this week's episode, I'm joined by Tommy Heffernan, which most of you may know as Tommy the Vet. With changes in regulations surrounding antibiotic use since the 28th of January 2022, Tommy outlines some key tips to ensure the health of calves from birth onwards. Tommy, you're very welcome. What impact are the current changes in the antibiotic regulations having at farm level?
The changes we're seeing are creating a little bit of fear. And what I mean by fear is, of course, we've got to change behaviors, but people are, I suppose, making assumptions that all antibiotics are going. And, we still are going to use antibiotics on farm, just we're trying to use them more prudently, using less of them. But it's not removing antibiotics completely. And I think that's an important thing sometimes, a message that gets a little bit lost. We need to look at the types of antibiotic we're using, the families. So we're saving these critically important antibiotics we use in human medicine. We're going to try and reduce our usage massively there. And then looking at group treatments, prophylactic use of antibiotics is going to be a thing of the past. So again, we sort of all know this focus on prevention is key. We still will be using antibiotics, but always aiming to be using less and less of them.
And I suppose we're well into calving season on many farms, and calf scours are an issue on some farms. What can farmers do to treat calves and prevent it becoming an issue?
It's an area I've been working very, very heavily over the last year, I suppose, so I'm biased maybe on it. But when we look at treatments of calf scour, the mainstay of any scour diarrhea is still rehydration therapy. I've been working with a company called Precision Microbes on developing a gut stabilizer, which is basically helping return the normal function of the gut, which is a liquid. It's been really, really effective as well. But I think the key thing is with treatment of diarrhea is getting in quickly, getting these calves rehydrated fast, and then talking to your own vet about maybe what the options are around gut stabilization for these calves. When we look at prevention, I suppose the key pillars of prevention for calf scour are still the same in beef and dairy farms. A big focus still has to be on colostrum. Hygiene, particularly when calves are indoors, is really, really important. And trying to avoid those stresses like cold and other things, and just having the housing environment as well as we can manage it during the winter period, and also as well, I suppose, for calves, even with your suckler calves, space is still a big factor. So having areas where calves can go back and lie in on straw that are warm and well bedded, I still think they're worth their weight in gold.
Most definitely. And coccidiosis is an issue on some farms, and we can see it in calves from a few weeks old to up to 6 months of age, and particularly with the extended winter period on some farms with the current bad weather. What can farmers do to prevent and treat it?
I suppose when you look at calf scours, and I didn't say, a lot of our calf scours are viral, and we also have the option of vaccinating cows, which boosts the colostral immunity, which is a huge resource and tool there as well. When it comes to coccidiosis, the challenge with coccidiosis is its ability, the ooze systems themselves, to survive, and then when they get into calves, their ability, and lambs, their ability to multiply rapidly to a level where they're infectious and causing the symptoms that we'll see, like a bloody scour or diarrhea, or even ill thrift in calves. So when we look at treatments, I suppose your coccidiostats are still, like your taltuzerols, dicluzerals, these are still the mainstay of treatments, along with rehydration therapy. When we look at prevention with coccidiosis, Catherine, some of the things I will say will be, year to year, if it's an issue, particularly indoors, that really intensive clean, killing any and getting rid of any oocysts in the environment, and then looking and seeing what stage do you get coccidiosis at, and looking at timing your preventative treatments, like your taltuzerol, before the risk period. And a lot of farmers will get coccidiosis when calves are outside, but they might start that cycle inside. So simple things then, like if you are creep feeding calves outside, making sure that you're moving feeders and that you're not allowing heavy buildup of muck in certain areas, and those leaking water troughs, all those areas where there can be congestion of animals, maintaining as much hygiene as possible there is really, really effective.
And crypto, Tommy, can also be an issue on some farms. How can farmers prevent it, and what's the best treatment?
I spent a year on one of the projects I've been involved in, really looking at crypto, because it's a huge challenge. And the challenge with crypto is, and I'm seeing, and in the research I'm doing, is that the cows are carrying the crypto And this is a challenge because it multiplies rapidly when calving starts. So again, back to the basics, hygiene is a really important one with crypto, which can be hard, of course, when we're looking at calf suckling cows, but trying to keep cows freshly calved and pre-calving cows, udders as clean as possible, feeding cows to make sure colostrum quality is good. There's a number of preventative strategies around crypto in the marketplace. Talking to your own vet there is really key, but focusing on the basics of hygiene and space, good quality colostrum helps, along with a good preventative strategy then.
And you've touched on there the preventative strategies that farmers are implementing, and previously maybe farmers were individually treating calves for respiratory infections in the past, but this year are considering maybe implementing a vaccination program. What advice have you for them farmers?
Well, are we all experts now in respiratory viruses after our 2 years, Catherine? I think we've all learned one or two things about respiratory viruses. They're a challenge, and I suppose, yes, vaccination is certainly something we all understand a bit more about, and I think a lot of farmers are considering respiratory vaccines. But there can be a little bit of confusion out there, I think, because of the number of vaccines, where you give live, intranasal, or dead vaccines. So it can be very farm specific. And I suppose if I was given general advice, I'm a huge fan of the live vaccines, the RSV virus vaccines in early. And then I think there's an awful lot to be said in sucker systems to follow up with your dead vaccines that contain a bacterial element. But do not forget the basics as well, the value of fresh air, space, and other stressors. So your calf that gets scour is probably 8 times more likely to pick up pneumonia. So we really need to think about everything that's affecting immunity and really focusing on, good quality colostrum, milky cows that are feeding these calves, and then infection pressure is the amount of viruses and bacteria these calves are exposed to. And that's things like fresh air, getting calves out early if we can. They all help. And then the vaccine is an extra tool to add and stimulate immunity. So when they do come across these pathogens, that they have the ability to fight these infections.
That's great, Tommy. And I suppose clostridial diseases can cause a number of conditions in cattle. What advice have you for farmers for preventing these?
Well, clostridial diseases, there's many of them, and they're varying, and we do see them appear from time to time, and you can talk to farmers and they wouldn't have a clostridial issue for years, and then suddenly, in a bang, they lose an animal or two. I would say very straightforward with the clostridial diseases. I've come to the conclusion the vaccines aren't very expensive. They work extremely effectively. I'm a fan of the 10-in-1 clostridial vaccines for cattle. Getting your 2 shots of these into calves early on as part of a vaccine program, they pay, because when you get outbreaks, you usually end up with disease or death. And I think get your clostridial vaccines in early, give them the 2 shots because they're dead vaccines. And I think it makes sense as part of prevention.
And for farmers that are purchasing in yearlings or stores this spring, Tommy, and taking them through to forward stores or finishing, what 2 or 3 things should they be focusing on when it comes to animal health?
Well, I think when you're buying in any stock, you're always looking at what you're seeing. I mean, we know what the norm is like. We're watching out for coughing, looking for nasal discharges. We're looking at the condition. We're looking for scours. The things we can't understand and don't know what's going on is internally is probably parasites. So when you're probably buying in stock, it's always worth considering. If you don't know the history, primarily you'd like to find out the history, but if you don't know the history, we're looking at liver fluke, we're looking at worm dosing to make sure stock are clean going out to pasture. I think they're the key things I would look at. We should be over the pneumonia risk with these stock, but again, you might have a vaccine protocol that you want to do on farm. You try and get these things in early. And again, when you're putting cattle out onto grass, simple things like avoiding adverse weather, because anything that causes stress is going to affect the immune system. And I'm 20 years qualified as a vet this year, and I'm beginning to think stress is a huge factor in so many of the diseases that we see, be it from a management or a nutritional or weather perspective. We need to minimize stress at all in animals, because if we can minimize stress, we minimize disease and we reduce antibiotic usage.
And for yearlings being turned out in the coming weeks, Tommy, a lot of that stands for those also.
Absolutely, same rules apply. We're looking at trying to minimize. Hopefully we have parasite control under control. If you've used a flukicide, just make sure if it was one that had just affected adult fluke, that you don't have immature fluke coming through. Again, checking the timing and dates of fluke dosing would be important. It mightn't even be a risk in your particular area. And then looking at worm control. But ideally, yearlings at this stage shouldn't be looking at dosing, maybe a second fluke dose. Our vaccine should be in at this stage. It should be a straightforward transition to grass. Again, look, maybe in the early spring, we'd always be watching out for bloat and things like that. But it should be a straightforward turnout, Catherine.
Thanks, Tommy. Some great advice and tips for the weeks ahead.
Thank you, Catherine, and happy safe farming to everyone out there.
That's all for this week's episode, and my thanks to Tommy for joining me on the show. You can catch up on all other shows and interviews from the Beef Edge podcast on the Teagasc website at teagasc.ie, or you can listen on Apple and Google Podcasts as well as Spotify. Don't forget to rate, review and subscribe so you never miss a show. For all other updates from our beef programme, keep an eye on our Twitter and Facebook pages. Until next time, I'm Catherine Egan, and thanks for listening.